it's a bit opaque what goes on, and the lungs in Africa, you're more exposed to indoor and outdoor particulate. So it looks like even at younger ages, you can get serious disease compared to, say, a rich country.
Do you worry about just how bad it's going to get for these poor countries? Because not only do they face, of course, the health care issues with a weak healthcare system, but then they're inevitably going to be the loss of economic activity. I mean, I think they said that India is going to have a 5% shrinking of its economy this year. Then the debt that they'll have to take in, it just feels like there's going to be a kind of cascading set of crises here.
Yeah, it's crazy because you've got so many of the developing countries having these huge setbacks. And not only do you have the direct death and sickness from this disease, but their health systems have no extra capacity. And the fragility of people's incomes, losing a bit of money there means that you don't have enough money to eat. It increases malnutrition. And these are governments whose very stability is always right on the edge. And so these setbacks can lead to instability, complete breakdown in governments altogether. And so, yes, the developing countries, even if their death tolls aren't gigantic, will pay a far greater price for the pandemic than the rich countries.
You've talked about the vaccine. When we talked earlier, you talked about treatment, and you were actually somewhat more optimistic that there would be treatments before there were vaccines. Where do we stand on that?
There's a lot of good things in the pipeline. The two that are out are the antiviral from Gilead, Remdesivir, which, we're trying to formulate that to be even lower cost. It's still hard to make and administer. There's two other antivirals that are coming along that could be done by the end of the year. Perhaps most promising are monoclonal antibodies, and we still don't know how large the dose will be, but within a few months, a few Eli Lilly, AstraZeneca, Regeneron probably will get emergency use authorization, and those, if they work as well as we think, could bring the death rate down by 70 or even 80%. And then finally, we have immune modulators. We funded a trial in the UK that proved one, called dexamethasone, worked well, but there's a variety of others, and figuring out exactly for which patients how to use those. So in combination, therapeutics could cut the death rate a lot even before the vaccine gets out, even though we will still want the vaccine to stop transmission.
Next on GPS,